So thank you very much to Xiao Lan and Dong Ho Kwak for performing here for us at this life science event organized by the Albino Project. Now we are going to move into the panel discussion, and I'm very happy to be here together with three of my colleagues working in the project. And we are going to have a little discussion on the topic of interdisciplinarity. This is something that we are interested in because we are a highly interdisciplinary project team, and trying to work together is perhaps not so easy, or perhaps is it? We'll hear when we discuss a little bit about how this is going about. So today we have then Hanne Scholz, who's the leader of the Albino Project. She has a doctorate in medical pathophysiology from the University of Oslo and is a senior researcher at Oslo University Hospital and the University of Oslo. She's the vice director and leads a research group at the Center of Excellence that work with hybrid technology, organ on a chip, at the University of Oslo. And then she's of course also then the leader of the Albino Convergence environment. We also have Dag Dysthe here, professor of physics at the Njord Center at the University of Oslo. He has worked in interdisciplinary groups with geologists, biologists, chemists, and material scientists for the last 25 years, so it's a lot of interdisciplinary experience there. And now he's mainly interested in the physics of biological processes and has initiated an interdisciplinary student biomaker lab, Lag Liv Lab. And also we have here Anne Danielsen, professor of musicology and director of Rhythmo Center for Interdisciplinary Studies of Rhythm, Time and Motion, where I'm also working. And she's an expert on popular music and Britain, in particular groove and other things, and is of course also then very into interdisciplinary research. So when it comes to interdisciplinarity, this is something that people often think about. I mean, you can have disciplinary work, which is kind of working within kind of your own discipline or framework. Then you can have different types of multidisciplinary work, cross-disciplinary work, interdisciplinary work, transdisciplinary even. I'm not really sure where Albino is in all of this. We can get back to that. But at least it's a kind of a complex thing to think about. So my questions to the panel to start will kind of be dealing with the interdisciplinarity. But also, when you're watching this stream, feel also free to ask questions to us, to the panel, also about the content of what you heard in the presentations, and we can also try to answer some of those. And if you're not able to answer these questions now while we are here live, we're only running here until 5, then we can also type some answers in the chat afterwards. Okay, so let's get started then. Hanne, leading the Albino Project, how on earth did you come up with the idea of putting together such a radically interdisciplinary project?
Yes, thank you. Good question. We heard the talk from the research fellow, and we heard about stem cell differentiation and that diabetes patients need these cells to live, and we all need them, of course. But making them artificial or from a stem cell and tell these stem cells to become insulin-producing cells and be able to work in the body to regulate blood sugar is difficult. And what we have learned since the developing of stem cell technology, since the breakthrough from 2007, is that the cells are, we can push them and we can make them produce insulin, but they are, the differentiation is not efficient, and also they are not mature. So there is still lacking some parts of the differentiation. And what we believe, I think that it's needed something else. And that's why this idea come up. The development of the body is in 3D, is in stimuli from a lot of other things. It's stretching, it's different stimuli that we cannot mimic by just putting in a drug to the cells. So I think that's the key to be able to achieve this goal. So that's why we came up with this interdisciplinary thought of working together in such a different field.
Fascinating. And then moving on to you, Dag. a physicist, and then many people think about physics as the hard sciences, kind of dealing with the hard stuff. But then now we're talking more about the softer part of things and biology. Why would a physicist be interested in biology?
Well, there are two main reasons. One is that there is lots of physics in biology. When you get down to the small details, forces and transport, there are lots of physics in there. And it's very exciting to be allowed to be part of the greatest revolution that we've got in natural sciences right now, understanding life. The other thing is that there is actually good physics. There's new physics in there. Many physicists deal with softer things, but inanimate things. But now there's a whole new field working on active soft things. And the physics of active materials is completely different. And phase transitions we are used to all the time from Archimedes, saying that there's earth, wind, fire, and water. Those are the four phases. But inside of each of our cells, we can maybe describe some of the complex things going on there as phase transitions. And this is new physics. It's exciting.
Great. And Anne, you're leading a very interdisciplinary research center on its own. And then you're adding on top of that, you're adding this interdisciplinary project. How is that?
It's challenging, but it's really, really fascinating. I remember when Hanne, we met the first time and you described this project to me, I was completely thrilled. And I also had some problems seeing what are we going to contribute to this enterprise. But then, I understood why. But I think the working interdisciplinary is challenging. One should not underestimate the challenges linked with working across disciplines. It requires mutual respect, mutual curiosity, and also I think also we need to acknowledge that we come from very different traditions with very different standards, different values, and even different research aims. I think I've experienced through the Albino project that the physicist is interested in explaining things, make things simple, and find the explanation for why things happen. In psychology, which is also a discipline in Ritmo, but in psychology and medicine, I think you're more concerned with whether things work. The aim is, or the goal is to find a treatment that actually makes the situation better for the patient. And we, in music, we are working with, when it comes to sound, for example, we're not so interested in treating sound as, for example, intensity separately from pitch or from rhythm, because music is interesting when all those different aspects are interrelated. So that's also a big difference. But I think we need to respect each other and kind of use the best from the different traditions. But what we've also experienced in Ritmo is that what you think is impossible when you start, actually after some time things develop, people start talking together, there is a dialogue. After some time, it's a very interesting dialogue going on, but it just takes some time. So I think people tend to underestimate how much time you actually need to build a real interdisciplinary research environment.
And now we have been going for about a year in the project, so we are starting to really get to know each other. The research fellows have really gotten into things and collaborate very well, and you heard the presentations from them earlier today. And then when you're thinking about, there are numerous challenges here, of course, but there are also many possibilities, and kind of can hear from you and perhaps start with Hanne about some of what are your ambitions here, and what can we actually really get out of this, and what can also be perhaps the outcomes of this in the end of this type of project?
Yeah, I think that follow up what Anne said, that it's important to be able to get out of your comfort zone, because you cannot stay in the small area where you used to work. You need to go further on, and with that you also open your mind in a new way. You learn new things. You learn to see as you said, the physics thought of the problem with new eyes compared to what you used to do looking at the biology's view. So I think this is that you can get a little bit out of that, and with that I think maybe there will be new development or new discovery that you haven't thought about, that you can dump into because of the interaction among people. And it's also interesting that being able to interact in the way we're building new equipment that can be used also not only for this project, but maybe for others, to study details that we normally not have been able to study because we have developed it in this project. So I think this is something that will come up out of this project also, that there will be spin-off for the future. And this is also one of our goals in Abina, that we want the project to continue also after our convergent environment are come to the end. If we are able to achieve our goal, that needs to be seen. But investing time in the beginning, I think then we have the best possible way to get a good outcome. I do think.
I think we can say that there are always many goals in such a project, because we've got the overarching goal that Hanne said, well, yes, we'd like to make better cells from stem cells. That's the big overarching goal, but of course on the way I'd like to understand why things happen, as she said. And I'm sure that you as musicians, you've also got other goals. You know, does our feeling for rhythm start at the cellular level, or is it on the organism level? And it's okay, but this is one of the interesting kind of dances of an interdisciplinary project, that we go with each other's goals, but we also are allowed to follow our own goals. But if we forget the others, then it breaks down.
And then, in your opinion, what has been most fascinating for you so far? I mean, in this interdisciplinary kind of endeavor.
To me, the most radical difference here is working with musicians. Because to start with, I didn't even know whether I believed that sound could really have any effect on cells directly, because I didn't understand the mechanism. And then going as far as thinking about rhythm, that was, far too far away. But now the latest results we've got, we actually seen different rhythms of different cells responding to sound. And, life is so complex that, yes, the complexity of rhythm may absolutely have a place there. And it really takes me time to get used to this idea and trying to understand how can we do this together.
I see now there's activity in the chat here now. So let me pick up on a couple of these questions and put them to the panel here. I think there's one important question here to start with that I guess that you could answer, Hanne, because it's kind of related to the overarching goal here. So Marcy P asks about, so we could put sound waves into the same category, such as physical drug, or kind of use that instead of a physical drug. Is that kind of the overarching goal here?
Oh, not exactly that but we understand that we follow the differentiation part by mimicking the development of the organ in the body. So it's kind of what we mimic is 9 months going on in the human body to develop the pancreas where the insulin producing cells is, and then we want to mimic that in the dish in the laboratory for 3 weeks. And we have learned a lot by the research of what kind of drugs is needed to tell the cells to go from one state to another. But what we believe that this is not the whole thing. So what we will to add in the stimuli, which is learned by mechanical, acoustical, way of putting energy into the cells, because we believe that there is some stretching going on when you develop as a human being. And as I said, everything is going 3D in the body. So we think that we need to add it. It might be also that we can take away some of the drugs and replace it, so we get a more simpler model, which will be an advantage if you want to develop this for a treatment, of course, or to develop the cells for modeling diabetes and diabetes research. So it will be a combination, but obviously there is not enough what we know today, so we need to improve that, and we think this is the way to improve it.
Great, thanks for that clarification. There's also a question here that I think could go to Hanne about the sound, and this is from Sorsol Rec, asking about the characteristics of the different sounds that we are using now at the moment and or can potentially use. Do you want to say something about kind of the sonic stimuli we're talking about?
Yeah, so far we have used quite simple sonic stimuli, but we would like to vary the different aspects of sound in a controlled manner. So one thing to think about is, like Thomas mentioned in his presentation, intensity. How loud is the sound, and what do the cells like when it comes to volume? We know also from the literature that if the sound is too loud, it doesn't work. So that's one important aspect. Pitch, of course, is another one, and also whether it might be that one pitch or one note or just one beat is too simple also for the sound, that they actually prefer more complex stimuli. We don't know, but that's also another aspect. And then, of course, coming from the Rhythmo, which is, we are interested in rhythm, of course, we are also very, very concerned with testing out whether rhythmic patterns, if that's also an important thing to consider. And of course there are endless variants of rhythmic patterns, so we will probably go for pretty simple rhythms also. And then we have, because we have also been thinking quite a lot of, as Dong Ho told us about in his presentation, about what kind of rhythms are actually going on in the body. And we have studied with the heartbeat, for example, is not like guk, 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 it's a cha-chung, 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 so it has a certain shape. And also the frequency or the heart rate varies over time. So there are many, many different aspects to consider, but we're trying to follow a plan and do it quite systematically. But as I said, investigating the rhythms of the body is like one interesting place to start.
Just a small comment, because I think that's super interesting, and this is also some complexity for the audience to understand, is that when you have cells outside in the laboratory, they need to be in water and water-based, because otherwise they dry out and die. Of course, they need nutrition and they need to be fed as we need to eat. So then it's the complexity is also that you need to transfer those signaling and those stimuli into a water-based solution, and also the outcome of what you want to read out, what you have developed from the cells. Everything needs to be very tiny and small and go very, very fast. So this is some of the challenge that we have been discussing during the last year, and then we will continue to develop it. But this is complex, but extremely important, I think.
I see that there are several questions coming in here, but unfortunately we are reaching our time limit today. We thought we should do this short and sweet, so we will have to end here, unfortunately, but the Abino project will continue for several more years. So we do encourage you to follow our web pages, where we'll post more information there. Publications will come, also the videos that you have seen today will be posted there. And we will also then be able to follow up on some of the questions and comments that we have here in the chat, also in writing later. But thank you very much for joining us today, and see you another time.